Arthritis is not what you think it is. A term used to describe 100+ diseases characterized by inflammation in the joints. It is the most common chronic disease in Canada that has no cure. Arthritis affects 25,000 children and adolescents, 1 in 6 men and 1 in 4 women, just like Karam.
I started experiencing what we thought was sinus issues, typical congestion, eye pain. My ears started getting worse, so I started losing my hearing. Next thing, I was coughing up blood.
I was talking very loudly right into her ear, trying to get her to understand the questions because there was so much going on. She was very, very scared and nervous of what was going on.
She came in quite unwell, very quickly kind of graduated through the levels of severity. There was bleeding in the lungs. There was quite a bit of damage to other organs as well. She had inflammation of the arteries of her heart. Essentially, when you break down some of the blood vessels in the lungs, you actually start bleeding into the lungs. Her lungs were at a point filling up with blood. The inflammation of her airways has led to various collapses of her lung. GPA, or granulomatosis with polyangiitis, is Karam's formal diagnosis. This affects eyes, nose, airway, ears, lungs, nerves, and sometimes muscle. She had kind of multiple episodes where different organs seem to be threatening to shut down altogether. People who have that type of arthritis are very high risk for dying. Her arthritis was so aggressive and the inflammation was so extensive that it was not clear that she was going to survive her hospitalization.
I started the treatment program within a matter of days. We now know that the vasculitis had impacted my heart as well, which caused all the arteries to become blocked and resulted in a cardiac arrest. I then learned that I had to live with heart failure. That was quite harsh to wake up to that news. I needed a defibrillator implanted so that in case I have a flare in the future, the arteries in the heart become blocked again. It will give me a shock. Yeah, I'm just sat in the hospital room by myself, having looked it up and just realised what it meant and thought, all right, this is life-changing. Like, how on earth are we going to do what we used to do? How am I going to hike again? How are we going to travel? How am I going to tell Matt? And, you know, the prospect that we might not be able to carry on doing the things that we love.
One in particular that was only coming into existence is a medication that she's on now that would still be considered an experimental medication, but has been incredibly successful for her. And so that has been kind of impressive to see, that seems to have been a successful tool.
It's treatable in the sense that you have an initial course to get you into remission, so that the initial course can last up to 6 months of IV therapy. It's a biologic treatment which comes with its own side effects. It causes infertility, hair loss, it can cause weight gain.
And if we didn't have it available, I actually do not know if we would have been able to control her arthritis long term.
My medical team are very much part of this journey, and I would not be here without them. You know, these things don't come around without research and funding from donors, so I am forever grateful, not just surviving what happened, but actually getting out and enjoying life and loving life again that I never thought possible.
Your donations will help patients like Karam. Please give generously.
Please give generously. Your support helps people like me living with arthritis.